Happy Wednesday. My name is Frank Douglas from Rights and Democracy out in Manchester, New Hampshire. I want to thank everybody who's joining us here today, and I'm excited to bring you my fellow Rights and Democracy member, Jody Newell. Tell them where you're from, Jody.
Thanks, Frank. It's great to be with you. I'm actually in Keene, New Hampshire, and I'm curious, where are you, to everyone who's watching? So if you could drop it in the chat, let us know, that'd be great. We're here to talk about what we can do right here, right now, in our communities to save lives from overdose. We've got some great guests, harm reductionists who save lives in every part of the country, and some whose lives were saved. We also have champions who are leading the fight in Congress, Representatives Carolyn Maloney, Paul Tonko, and Senator Elizabeth Warren. But first, Frank, will you get us started?
Wherever you are, welcome. If you're with us on Crowdcast, say hello. Tell us where you're from and why you're here. If you're with us on Facebook or Twitter, follow the link at the bottom of your screen to join the conversation. Tonight's event is co-hosted by the People's Action, a national network of grassroots groups, and CPD Action, a project of Center for Popular Democracy. We'd like to give a shout out to everyone who has helped us make this happen tonight, and everyone who supports harm reduction.
Every one of us has a reason to be here. So what's yours? Maybe you've lost a friend, your partner, a son, or a daughter. Maybe you've struggled with substance use and recovery yourself. Let's take a second to remember everyone we've lost and say, not one more.
That's right, Jody, not one more. March 25th will mark 3 years since one of my best friends died. I think about her every day, and I've had enough. I'm tired of seeing the people I grew up with pass on and hear sad stories about their last moments of their life. So this is why I'm here, is to fight the overdose crisis.
Yeah, I understand that as well. And I'm here because I lost my fiance to overdose. Corey was not just my fiance at the time, but he was also the father to my 2 boys. So I know very deeply how harm reduction could have helped him and what happens when we don't use these life-saving tools. So I invite all of y'all who are with us on Crowdcast to share a little bit about why you're here and who you're fighting for.
Thanks, Jody, and thank all of you for sharing your stories. We hear you. It means a lot. Now, what can we do? Let's hear from President Joe Biden in his historic State of the Union address last week.
It's important. It's important for us to show the nation we can come together and do big things. So tonight I'm offering a unity agenda for the nation. 4 big things we can do together, in my view. First, beat the opioid epidemic. There's so much we can do. Increase funding for prevention, treatment, harm reduction, and recovery. Get rid of outdated rules and stop doctors stop doctors prescribing treatments. Stop the flow of illicit drugs by working with state and local law enforcement to go after the traffickers. And if you're suffering from addiction, you should know you're not alone. I believe in recovery, and I celebrate the 23 million Americans in recovery.
You heard that right. The president says saving lives from overdose is job number 1 for our nation. And we can do it through harm reduction. But Jody, what exactly does that mean?
Every year, more than 104,000 people die from preventable overdose deaths. Let me say that again, 104,000 people. That's more than 280 people dying every day. It's heartbreaking and it's tragic, but it doesn't need to be that way. So let me be real clear about it. These deaths are preventable. We know how to save lives. Overdoses don't have to happen. And when they do, they're reversible if we put harm reduction into action.
Too many of us are dying because of the war on drugs, and the US leads the world in incarceration rates and preventable overdose deaths. It sounds like more of a war on the people than the war on drugs.
But there's good news, because for the first time in history, a sitting president has named harm reduction as a solution that saves lives. You heard it yourself, right? And there's important legislation moving through Congress. But as many of you know, harm reduction isn't new. It's proven to work. We have a long legacy of saving lives and fighting for the people. What is new is, for the first time, the federal government has allocated funding specifically for harm reduction. Last spring, through the American Rescue Plan, Congress allocated an unprecedented $30 million for harm reduction services like syringe service programs and naloxone distribution. This is historic, and it's a step in the right direction.
That's right, Jody. President Biden and Congress are taking significant steps to invest in harm reduction, and we'll hear more about that in a minute. But the opponents of harm reduction, they don't want you to know that it saves lives. They use misinformation and racism to scare us away. We're not scared. We're never scared. We have to call out these lives. So whoever you are, wherever you are, reach out to your local offices. You tell them the truth. You demand they support legislation to save lives.
The overdose crisis affects all of us in every walk of life. As the president says, we can beat this, but only if we pull together. That's why People's Action and CPD Action work hard every day to build bridges across race, place, and experience. And tonight, we'll hear from folks all across the country, cities, towns, and rural communities. So often, those who profit off of this crisis and the politicians they support divide us by telling us that it's the other person causing the problem. But we're committed to joining together and not falling for those lies.
That's right, Jody. Some politicians choose to prefer lies over lives. But to quote DMX, they think it's a game, but this is not a game. There are real lives lost. Overdoses are one of the few things in this world that does not discriminate.
Exactly. The war on drugs created this crisis, and pharmaceutical and insurance corporations have made it much, much worse. But the overdose crisis reminds us that we're all human, and no matter what we look like or where we come from, our ability to get and stay well depends on everyone having what we need to prevent, treat, and recover from illness. So as we move forward, let's ground ourselves in 4 core principles. Number 1, centering those directly affected. Number 2, awareness of historic context. Number 3, unity in struggle. And number 4, harm reduction to save lives.
Thanks, Jody. Tonight we'll focus on harm reduction, the most effective way and evidence-based way to save lives from overdose. I want to invite Lil from the National Harm Reduction Coalition to break it down for us. Hello, Lil.
Thanks, Frank. Hey, everybody. I'm Lil Prosperino. I use they, them pronouns, and I live in rural Southern West Virginia. Harm reduction is my career, but it's also my life, and it really saved my life. Harm reduction saves my friends' lives pretty much every day. Because I grew up in Central Appalachia when pain pill clinics were flooding the region, I grew up around drugs. I grew up around incarceration and overdose death. It's something I've known since I was very, very young. Harm reduction is a set of practical strategies, tools, and ideas that are proven to save lives by reducing the negative consequences associated with drug use, sex work, or other behaviors. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs and people who work in the sex trade. Harm reduction meets people where they are and doesn't judge them. So concretely, harm reduction reduces the potential harms from drug use. Some examples are syringe service programs for people who inject drugs, naloxone distribution, which is the overdose reversal drug for opioids, increased access to medication for opioid use disorder, which used to be called medication-assisted treatment, safer smoking and safer snorting supplies, or safer injection education. These are just a few of the tools and strategies that are scientifically proven to save lives. Harm reduction really started as an underground movement led by people who were seeing their loved ones around them die. So harm reduction has radical roots in direct action and civil disobedience, and is ultimately still a movement for social change, striving for liberation of people who use drugs. Like many social change movements, it encompasses some core principles. So we're just going to go through those. We call these at NHRC, we call these the principles of harm reduction. So number 1, lots of humans have relationships with substances, and it doesn't do much good to ascribe moral judgments to that. Number 2, drug use is a large continuum of behaviors, and trying to decide if our use is problematic or not can be really subjective. So instead, we go along with what all the change models say about people and humans and how we change. But we focus on those small incremental changes, the small positive changes, and the strategies to stay safer. Number 3, the goal of harm reduction is really quality of life and well-being for people who use drugs and the communities that they live in. Number 4, in order to meet the needs of people who use drugs, harm reduction services must be working to eradicate stigma. So stigma is, the oppression of people who use drugs, and the way that it comes out can be really harmful and prevent people from services. Number 5, harm reduction works best when it's led by people who use drugs, and when people who use drugs have a real voice in how programs are created, implemented, and maintained. Number 6, harm reduction education should focus on tools that can be shared through networks of people who use drugs. So whether or not a person touches a harm reduction provider directly, these tools should be accessible and be able to be shared through networks of people who use drugs and through the underground economy that people who use drugs already have and use every day. And number 7, the drug war is racist, right? We've been talking about how it's a war on people. Harm reduction as a movement is not free of racism, classism, ableism, transphobia, misogyny, or any other social inequities. So it's the responsibility of the harm reduction movement to address oppression and ensure that our movement recognizes that all kinds of people use drugs and that we show up in ways that aid in the larger struggle for collective liberation. And lastly, number 8, the drug war is a war on human beings, right? It's genocidal. The drug war is genocidal. Many of our loved ones are dying, and people like me are dying. So a lot of us are coming to the table navigating years of grief and loss already. So harm reduction really seeks to interrupt the genocide. The most important part of harm reduction to me, of course, is radical love. Harm reduction is radical love. Harm reduction is community. In many of our communities, including mine, harm reduction is either illegal or extremely overregulated. So saving lives is illegal. And those of us who are devoted to our community take risks every day to keep our community safe. I know I'm sick and tired of feeling unsafe and living in this pervasive pit of grief and loss. So it's time that we invest in harm reduction and bring our friends and loved ones out of the shadow. Harm reduction works, and it works best when it's led by people who use drugs. I'm going to kick it back over to Frank, who can tell you a little bit more about where I work at NHRC.
Thank you, Lil. I do appreciate that introduction. And you know what? We do want to help these people get out the shadows and have safety through harm reduction. But I would want you to bookmark this page, harmreduction.org. That's Lil's organization, the National Harm Reduction Coalition, where you can find everything you need and know to save lives. Right, Lil?
Yes, we have free trainings and free webinars all the time. We have all kinds of free resources online. So I encourage you to join us someday, especially if this is your first introduction to harm reduction. Just know that we need you and we'd love to have you.
Thanks, Lil. Now I'd like to invite Heaven from the Center of Coldfield Justice in Pennsylvania, to share why she invested in harm reduction and why it matters to her. Welcome, Heaven.
Hello. My name is Heaven Sensky. I am the organizing director for the Center for Coldfield Justice here in Southwestern Pennsylvania. And while our organization may work mostly on environmental justice, we recognize that these issues are interconnected, particularly in Appalachia. And also growing up in Appalachia, as Lil mentioned, this crisis has touched home for all of us. These past few years have brought many new challenges to our families, including mine. I lost someone very young and dear to me to an accidental overdose. My loved one experimented with what they thought was an authentic Oxycontin that turned out to be fake and laced with fentanyl. They left behind a loving family, friends, and a community who continues to mourn similar losses. We will never get them back. And after this major life-altering loss for me, I began to notice that these losses were continuing to occur and at high rates. Last March, 4 young people died in our community from drugs that were laced with fentanyl, cocaine. And it's unclear how many lives have been lost to overdose in the past year and in between. It is very clear to me, however, that these losses were preventable, and I want to do something about it. I began to learn more about what could have saved my loved one that fateful night, who, no matter the circumstances, deserved to live. And so I began my journey in learning about harm reduction. Harm reduction is, of course, a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Because harm reduction meets people where they're at, it is the best method we have to save lives. We all know someone, we all love someone who has experimented with drugs. Many of us have done this ourselves. The consequences of drug use does not have to be death, even for those far from their journey to recovery. And so it is obvious that minimizing the existential impact of the overdose crisis is good for all of us. We all lose when people are dying. We all lose when our neighbors are suffering. We have all already lost so much. So why not advocate for tools that keep people alive? One way we can prevent harm is with fentanyl test strips. This is a harm reduction tool that alerts users to the presence of the substance. It would have saved my loved one. Sadly, this tool is illegal to possess in the state of Pennsylvania. We have the tools at our disposal to save lives. Test strips are a few dollars. We can't even distribute them. We need the ability to use them. In addition, we know that Narcan, otherwise known as naloxone, is a life-saving tool that reverses the impacts of overdose. It's $130 over the counter in Pennsylvania. It should be in all of our cars, our purses, our homes. People should have access to this. Another form of harm reduction is clean needle exchanges, where folks using IV drugs can go to receive clean needles, which further prevent the spread of disease. And above all else, when these resources are available, they also provide a far more attainable path to recovery. In order to make these services more accessible, we can all work together across our communities, across regions, to halt the harm and save lives in real time. Harm reduction is keeping people alive, period. There is no rebuttal to that. Thank you for coming to learn more about harm reduction strategies and philosophy in order to make life-saving services more attainable to the people in my community and to my loved ones. Together, we can cut down on negative stigma that drives people who are struggling further into the dark. We can work together to advocate for better practices that will most certainly save lives and drive change. Thank you. I'm going to be passing it to Jody now.
Evan, thank you. Sorry. Thank you so much for sharing your story, and thank you for being with us. Now we're going to hear from Paula Santiago from Vocal New York. Paula has spent years putting harm reduction into action. She has saved countless lives by spreading compassion and care to strengthen our communities. Paula, welcome.
Thank you. My name is Paula Santiago. I work at Vocal New York as the peer education and peer delivery service exchange manager. I've been doing harm reduction for over 30 years because it is the most human approach for working with active drug users. I'm here to tell you a little bit about what harm reduction looks like on the ground. Harm reduction spaces are safe environments where participants feel not judged and treated with compassion and respect. When someone walks through a harm reduction program, they're greeted with a smile and they're asked to come and join a community, a family. Harm reduction centers provide care coordination, counseling, mental health services, Hep C testing, navigation for Hep C treatment, groups, meals, showers, laundry, overdose prevention training, and supplies like condoms and new injection equipment, smoking kits, Narcan kits, wound care kits, hygiene kits. We offer referrals to mental health services, to drug treatment programs, to housing programs, to pantries. Lately, we've done a lot of referrals to COVID-19 vaccination sites and to other medical providers. Harm reduction centers are also very innovative in their approach, including holistic services like yoga, Reiki, visualization, acupuncture. These centers celebrate diversity and community, like History Month, Gay Pride, Thanksgiving dinners, holiday parties, graduations, birthday parties. And we also have peer programs. Peer education training to participants is offered in order to prepare participants for job opportunities doing peer delivery syringe exchange. At Vocal, we have 9 sites that we visit in Brooklyn, and peers go to these different neighborhoods, connect with active drug users, introduce them to the organization, and provide services for them right there in their neighborhoods. They provide information, referrals, supplies. They collect, return, or use syringes for the proper disposal of them. And they also assist in-house when needed. Many participants end up coming to the centers precisely because of the work of the peer educators. And when they walk in and they're in this environment where they participate in group and they're heard and taken seriously, they become part of a community. This is a place where they feel wanted, needed, important, and included. Harm reduction works because there's nothing more important for a human being to feel human. I have seen personally many individuals improve the quality of their lives because of the work of harm reduction programs. As humans, we take care of each other, and we also take care of ourselves and our communities. This is the reason why I have devoted my life to harm reduction, and why I hope that you will join me in strengthening and fighting for harm reduction access across the country. Back to you, Frank.
Thank you, Paula, for all the work that you've done. You are a legend in this movement. Let's hear in the chat, what do you think of Paula's work? Now, I want to invite Thomas from River Valley Organizing in Ohio to share why harm reduction is important to him. Take it from here, Thomas.
Hello, my name is Thomas Powell. I work with River Valley Organizing in East Liverpool, Ohio. I'm the civic engagement organizer for our organization, but I've been practicing harm reduction for almost 2 years. It'll be 2 years in June, actually. And before I worked in harm reduction and civic engagement, I was an out of control, chaotic user. and it was to no fault of my own. I remember being in grade school, like 5, 6, kindergarten age, and they misdiagnosed me with ADHD when in all reality, I have bipolar schizophrenia. So they put me on all these ADHD meds, which are all amphetamines and highly addictive substances. And it got to the point where I remember being in like 3rd grade. And if I missed one of my pills, like if I ran out or I just forgot, I would be in recess throwing up in the corner because I was going through withdrawals at age 9. And this went on for most of my life. And then when I turned 18, they decided that ADHD was a child's disorder and took me off of all my meds. And at that time, I was on about 5 meds a day, and 4 of those were highly addicting. And when you're sick, you do something about it to get better. And I didn't know what else to do. My friends started giving me just whatever they had that would make the sickness go away. At that point in time, it was Adderall, but then the Adderall turned into cocaine, and then the cocaine turned into meth, and it was just a downward spiral from there. I'm super lucky though. After I overdosed 4 times, the 5th time I overdosed was really bad. I actually like died. They had my time of death written down, and a rookie EMT, and I'm really sorry that I'll never know his name, but he decided he was going to hit me one more time, and that one last time getting hit with the Narcan brought me back, and that was the moment I was like, this is it. And a lot of people don't realize that. They're like, well, why don't you just quit? There's nothing you could tell somebody who is in chaotic use that would make them want to quit. They have to make that decision for themselves. And like I said, I'm lucky. I'm one of the lucky ones. There was no harm reduction, or at least none that I knew of when I was using. So the fact that I'm here right now is amazing. I have many friends who are no longer here anymore, who can't fight this fight that I'm fighting because there was no harm reduction around. Because nobody had Narcan, because there was no accessible sterile supplies, and because the stigma behind it, they didn't want to go to the hospital to get their sores looked at, because you get looked at just like a low life. You get looked at just a horrible person. You're less than people at that point with the stigma. Since I've been practicing harm reduction in 2021 alone, I saved 32 lives. That's 32 people that are here right now because people knew that I had Narcan. Out of those 32 people, I know at least 10 of them are doing very, very good with themselves and turn their lives around. And I'm really glad that I was able to be a part of keeping them healthy and alive long enough for them to make that decision for themselves. So in conclusion, sterile supplies save lives. Narcan and naloxone saves lives. I can't stress it enough. If anybody needs it, my number is 330-708-4097. I will ship it across the world if I have to get you some Narcan. And harm reduction works. If you have any other questions about me or what we do, look up River Valley Organizing on Facebook. And with that, I thank everybody for being here. You know why I'm here, and I think you need to ask yourself, why do you want to fight this fight? And with that, I'm going to give it back to Jody.
Thomas, thank you so much. I could hear it 1,000 times and it'll get me every time. So much of that resonates with me. And just thank you. It's amazing. 10 people, even one person would be amazing. Anyway, thank you so much for sharing. These are just a few examples of the lives that have been touched by harm reduction, by compassion and action. Now, like I said, we've got some good news for you tonight. Congress and the president are finally talking about putting harm reduction into action, but they need our support to make it happen. So over the last few years, our groups have been working to build up champions in Congress on these issues, and tonight we'll hear from 3 of them. To start, let's hear from one of our champions, Representative Paul Tonko from New York. He has introduced an important bill. It's called the Mainstreaming Addiction Act, or the MAD Act. It now has 240 co-sponsors in the House. Passing the MAD Act would mean an immediate increase in access to treatment and harm reduction. Welcome, Representative Tonko.
Hello, everyone. Hello, People's Action and CPD, and an honor to be with all of you and to share with you that I'm proud to support harm reduction policies. When we're losing over 100,000 of our friends and our neighbors to the devastating disease of addiction, we need to do everything we can to save lives. I was so excited to hear President Biden commit to working on harm reduction strategies in his State of the Union message. I was excited to hear our president call for strong bipartisan action in Congress to eliminate outdated barriers, preventing health professionals from prescribing life-saving addiction treatments. My Mainstreaming Addiction Treatment, or MAT Act, directly addresses the president's call by removing those needless red tape situations for buprenorphine and opening the doors of access to this life-saving medication. As you all know, the X waiver reflects a long-standing stigma around substance use treatment and sends a message to the medical community that they lack the knowledge and that they lack the ability to effectively treat individuals with substance use disorder. Keeping the waiver in place simply continues to create a barrier to access to treatment. So my MAT Act would eliminate the outdated requirement that practitioners apply for a separate waiver through the DEA to prescribe buprenorphine for the treatment of substance use disorder. I will also look for ways that we can support harm reduction policies in the substance use block grant reauthorization, which, by the way, I am leading. I do welcome your feedback and advice on how to best do that. Your input is essential. I will continue to support funding for syringe services programs and will help lead the effort to get my colleagues to do the same. It's important for us to continue to push for those policies and those resources that will enable us to save lives by conquering the illness of addiction. And with that, I again thank you for the opportunity.
Thank you, Congressman Tonko. Next, I want to invite Representative Carolyn Maloney to join us. She is leading in the House on the Comprehensive Addiction Resources Emergency Act, which is called the CARE Act, which would provide $125 billion over 10 years to fight the overdose crisis, with specific attention to the hardest hit states, counties, and cities. Welcome, Congresswoman Maloney.
Hi, I'm Congresswoman Carolyn Maloney. Thank you to People's Action and Center for Popular Democracy for convening a discussion on the critical importance of harm reduction in preventing overdoses and protecting our nation's public health. Let me make this very clear. Harm reduction saves lives. Syringe service programs save lives. Overdose prevention centers save lives. Ending America's overdose crisis and removing stigma in healthcare are two causes that are very important to me. I am proud to lead the Comprehensive Addiction Resources Emergency Act, or the CARE Act, with my colleague, Senator Warren. This legislation is the most ambitious effort Congress has ever undertaken to end the country's overdose crisis. It would provide billions in new funding directly to communities and community-based organizations working to save lives, including funding for harm reduction services. I am confident this bill would help turn the tide on our nation's overdose crisis. As a New York City Congresswoman, I am also proud of the leadership that our city has shown with the recent opening of America's first 2 overdose prevention centers. In just a few short months, these overdose prevention centers have prevented hundreds of fatal overdoses and memorialized our city's promise that every person, regardless of whether they use drugs, deserve to be treated with compassion and dignity. Let me also take a moment to thank President Biden and his administration's leadership on addressing overdose as the public health crisis that it is. I was pleased to hear the President's pledge to end the overdose crisis and invest in harm reduction services during his State of the Union address. And through the American Rescue Plan, President Biden established the first federal fund dedicated exclusively to harm reduction. This was a landmark moment in our long fight to destigmatize treatment and care for people who use drugs. Before I conclude, I'd like to take a moment to acknowledge the tragic loss our nation has experienced as a result of overdose during the coronavirus pandemic. Every life lost to overdose is a life lost too soon, and the damage inflicted upon our communities is irreversible. I thank you for your leadership and your partnership, and I promise you that I will continue to work tirelessly with my colleagues to bring an end to this crisis.
Thank you, Congresswoman Maloney. Last but not least, let's hear from our champion Senator Elizabeth Warren. She is leading the fight for the CARE Act in the Senate and fighting to make sure harm reduction is well funded in our federal budget. Take it away, Senator Warren.
Hello, everyone. I sure wish that we could do this in person, but I am very glad to have the opportunity just to pass along a message. I want to start by saying thank you to the Center for Popular Democracy and People's Action for inviting me here today. And thank you for the work that you do day in and day out, fighting for a more just country. So I wanted to take this chance to talk about our fight against the substance use disorder crisis and how we need to tackle this crisis head on as the public health crisis that it is. We know that one of the most effective ways that we can fight this crisis is through harm reduction programs. But these programs are under attack by Republicans who make wildly false claims about what the programs do. Let me be clear. Harm reduction saves lives. Harm reduction recognizes the dignity of every person. And local leaders, health officials, first responders, and those facing substance use disorder all agree. So now is the time for us to double down on our investments and our efforts in the fight against the substance use disorder crisis that our country is now facing. I was really happy to hear President Biden commit in his State of the Union to address investing in harm reduction and to end our overdose crisis. And I'm glad that the American Rescue Plan invested $30 million in harm reduction programs. But I want to highlight one more idea because we can do more. In 2018, the late Congressman Elijah Cummings and I were proud to introduce the Comprehensive Addiction Resources Emergency Act, or CARE Act. We did this in partnership with dozens of organizations and public health experts like CPD and People's Action to make record investments to tackle this crisis. And last year, I was glad to partner with Congresswoman Maloney, who I know is speaking today as well, so that we could reintroduce the CARE Act with more than 100 of our colleagues in the Senate and the House. The CARE Act would devote $125 billion over 10 years to addressing our substance use disorder crisis. And it would give $5 billion to projects that provide treatment, recovery, and harm reduction services. So I'm all in for giving harm reduction programs the resources they need to save lives. The Biden administration is all in, and I appreciate that you are all in. We need your partnership in this fight. We need your partnership to pass the CARE Act and end this public health crisis together. Thank you, everyone, for your hard work. We're in this fight together.
Wow, it was great to hear from members of Congress. And great to know now that we finally have some real champions in Capitol Hill. Congress does have the power to invest in harm reduction, and this will save lives. Jody, tell us why this matters so much right now.
Thanks, Frank. You're right. Our elected leaders have this power, and we need to make sure that they act now to use that power in the right way. We need to pass the MAD Act and the CARE Act for all of the reasons you just heard. And we simply need Congress to invest in harm reduction programs through our federal budget. Since the war on drugs was declared 50 years ago, federal funding was blocked from syringe access and other harm reduction services, even though these programs are proven to save lives. As we heard tonight, funding for these services can help stop the surge of preventable overdoses and the rise in hepatitis C and HIV across the nation. We know that harm reduction works. It saves lives. The president's comments show us a changing course from the failed strategies of the war on drugs, but only if we follow through. Frank?
Thanks, Jody. This legislation needs our support, and that depends on all of us. So reach out to your elected leaders and tell them what steps they're taking to prevent overdose deaths. This is actually how I got started. One day it just came to me. I was frustrated, thinking about the loss of my friends. And I went to City Hall in Manchester and I said, what are you guys doing to prevent overdose deaths? What steps are you taking in harm reduction? Because we need to get rid of this stigma and save lives. So yes, everybody do what you have to do, write letters, anything, so we can get harm reduction to the forefront.
To all my fellow harm reductionists on Crowdcast, I want y'all to drop some love in the chat for the power we're building together. Now, I want to invite all y'all to show the world right now that we can support harm reduction and we aren't going anywhere. So let me invite Vinay to share what we can do right now to show our strength.
Thank you so much, Jody. Hi, everyone. My name is Vinay with he, him pronouns. Calling in from Brooklyn with the Center for Popular Democracy. I run our overdose cohort with people doing harm reduction work across the country. I'm so grateful to be here right now. Thank you to everyone who spoke and told their personal stories. I know that's not the easiest thing to do. And thank you for modeling, how to use your stories to help transform this country, because that's what we're trying to do here. And I think tonight we've made it very clear that harm reduction works. We heard that from directly impacted folks. We heard that from organizers. We heard that from our champions in Congress. And now, before we wrap up the call, we need to hear it from you, right? Because everything we're trying to accomplish here depends on you and your people power and you telling your stories. We can't pass the MAD Act without you, or the CARE Act, or get investments in harm reduction. We need all of you telling your stories, wielding your people power to get where we're trying to go. And we've done this time and time again to transform healthcare in this country, and I'm confident that we can do it again starting tonight. So to make that easy for you, we are sharing an action portal. The link should be on your screen right now. So I'm going to give you a second to follow that link, go into an action portal, get yourself set up there. And what you're going to find there is a whole host of resources. And you'll see one-pagers, descriptions, literature on harm reduction, kind of reviewing what we talked about today in greater detail. And you'll see 2 action items. So I'm going to make 2 asks of you right now. First action item that we're all going to do together, it'll be fun. We're all going to do it together on this call, is we're all going to tweet at our representatives. And we've made this super easy for you. If you go to the action portal, you can just see, if you put in your address, it'll populate the tweet for you. It'll find your representatives. And we have a pre-written tweet that you can send out to your representatives using the hashtag harm reduction works. You can edit it. You can add in a personal story. You can tag any organization you're working with, make it your own voice. Or if you want to, you can just send it out as it is. So everybody go ahead. I'm going to give you like 30 seconds. Like, do it right now. Let's do it together. For anyone wondering, these things do make a difference. Like, every legislator has staffers who are keeping track of how many times constituents reach out about an issue. So we're all doing this together. There are hundreds of people watching this. That's a big thing that we can all do. Very easy thing to do. So let's all take a second and do it right now. While you're doing that, I do want to give a special shout out to 2 friends of ours, Albie Park and Jess Tilley, who are very invested in this work and actually use the slogan harm reduction works, and we're very generous to let us use it tonight. So thank you, both of you, for that. And yeah, everyone get out there, get those tweets off, talk to your representatives. And the forum that we shared is live today, it's live tomorrow, long term. So share it with your friends, share it with your networks, get them tweeting tonight and tomorrow. Let's get this conversation going. And then one more thing before you go tonight is there should be a volunteer form in the action portal, or if not, we'll share the link to that. And make sure you sign up, because we don't want this to be a one-off event, right? We want you to come back. We want to build our people power. People's Action and Center for Popular Democracy will use that form and plug you into lobby visits, into phone banks, into rallies, into actions, get you face-to-face with your representatives. So please, before you leave tonight, make sure you sign up on that form so we can get back in touch with you and plug you into action. And yeah, that's it. So thank you all for being here. Thank you for being invested in this work. And I'm very confident that, if we wield our people power together, we can really transform healthcare in this country through harm reduction. So yeah, thank you. I'm going to pass it back over to Frank to wrap us up and introduce a special guest. So Frank, take it away.
Thank you, Vignay, for helping us take action. And for everyone here, thank you guys for joining us. You could be anywhere else in the world, but you chose to spend time spend time here with us, and we appreciate that. Now, I do want to introduce our friend. She's an amazing singer from Chicago. Her name is Sandra Santongiorgi, and she's going to perform one of those powerful songs, I think, Stand By Me. Thank you very much, Sandra.
Hello, everyone. I'm Sandra Santongiorgi, and I'm a singer, songwriter, and a painter from Puerto Rico, based here in Chicago. I'm here in my studio with Janet Kramer, who will be accompanying me. And together we'd like to thank you for inviting us to be a part of this really special event, because we all need to do everything that we can wherever we are to save lives. So many of us have lost somebody that we loved, someone that was so dear to us. And this is why I ask you today to stand with me, to stand by me, to stand with us, because together we can make change. When the night has come and the land is dark and the moon is the only light you'll see, no, I won't be afraid. No, I won't be afraid. Just as long as you stand by me. So stand by me, yes, stand by me. Ooh, stand now, stand by me, stand by me, yeah, yeah. If the sky that we look upon should crumble and fall, or the mountains should crumble to the sea, I won't cry, I won't cry, no, I won't shed a tear, just as long as you stand by
stay